here. I'll tell you a little bit more about me. I'm a person in recovery from addiction. I was going to say my name is Ray and I'm an addict. Oh, hi. That's the right answer. But if you lead with that, what happens? You turn off a part of the audience because there still is some stigma. I retired from clinical work in occupational addiction medicine after seeing about 5,000 or more people, assessing them. The majority of them got back to work and did pretty well, I think. I mean, it's a very treatable condition. I'm going to talk a little bit about substance use and safety, and addiction, treatment, and recovery. And I'm going to try to convince you that it is your business. We'll talk about mental wellness or mental health in the workplace and why that is a safety issue, but it's also really an important issue for recovery from addiction. And recovery is all about forming communities of recovery. The answer to addiction isn't treatment, it's connection. And the workplace is the most important connection that a lot of people have. It's sort of their family. And so it's really, really important. And then we'll talk a little bit about a couple of issues that are problematic right now, marijuana and opioids in the workplace, and how to manage that. So what is addiction? And this is one of your test questions, so pay attention for a sec, because it's on the final. But addiction is it's a primary disorder. Primary means that it stands alone. Primary disease or primary disorder means it's not secondary. It may be that I started using because of emotional trauma, or I started using to self-medicate mental illness, or something like that. But once I've got this disorder, it's like heart disease. Once I've got it, it's primary. Treating the other issue isn't going to deal with the addiction. I have to address the addiction. So that's what primary is. A lot of the issue is changes in the brain, and I've got it, although I haven't used anything for nearly 34 years. I've got alcoholism, not alcoholism. So I still got those changes. Mark this morning talked about neuroplasticity. And neuroplasticity is a really interesting concept. You're just laying down new brain connections, new brain tissue over the old. But it's like putting roofing on a roof with a hole on it. You got a nice new roof over top, but there's still a hole underneath. You still have the issue underneath that. And I've still got that, and that's why I've still got to do certain things to stay in active recovery. The way I know I have addiction is when I start using my substance of choice, or not choice, or substances, usually they come in clusters, or behaviors, I can't be sure how much I'm going to do, how long I'll do it, or what my behavior is going to be like. I've got impaired control. And that's the sine qua non. That's the secret of addiction, is impaired control. So when Nancy Reagan said, just say no, she didn't understand that, because the person with addiction isn't as able to put the plug in the jug, especially once they've had that first drink, than the person sitting next to them. The other things that we assess for during the diagnosis of addiction is, does a person keep doing it even though there are negative consequences, like important negative consequences, like marital consequences, workplace consequences, legal consequences, emotional consequences? Is there compulsion? In other words, does my drive to use my substance or my behavior, gambling or sexual compulsion, does it take on a life of its own that it crowds out things that were once important to you? You look at the person and you say, how could they do that? Because she's a mother. And doesn't she care about her kids? The problem with addiction is the addiction becomes so compulsive it crowds other things out. So it means that the person would take risks that they would not have taken before. And that's part of the disorder. And finally, craving may or may not be present. It isn't always there. So addiction, the important thing is to remember that it's primary and that it's diagnosable. if we look at the left of the diagram, about a fifth of the population chooses not to use substances. That includes people like me that used up their drink tickets. But so in that group, there are the people who can't safely use anymore, but a significant number don't use addictive substances. Then there are those of you who can use alcohol, and now I understand you can smoke the odd doobie and get away with it, no loss of control, no compulsion, no consequences. And that's the majority of the Canadian population. And then, now, it's really interesting because today, I would have said earlier this morning, I would have said the abuse group is your young, predominantly male, 17 to 23-year-old who drinks and drugs stupidly. They choose to do it in a dangerous way. It puts them at risk and they can die in accidents. And those are your high-risk people in the workplace. But what did we see with the fatalities in the last year? We saw that there were a lot of old codgers like me who also died and I can understand why. There's a number of reasons that we're at increased risk. So the risk doesn't just end there. But anyway, abuse is not the disease of addiction. Abuse is a choice. And what's the right way to handle it? Well, the right way to handle it is A, they'll grow out of it, or B, discipline is appropriate because they do have control. And then finally we cross this red line. We call it the pickle line because on the right side you're a pickle, on the left side you're a cucumber, and you can't go back once you've crossed. And that actual metaphor is kind of accurate because there is a demonstrable change in the mesolimbic system of the brain that once addiction has occurred, there's changes in the neurotransmitters and the dopamine and some of the other transmitters and receptors of the brain that are relatively permanent. The interesting thing about addiction, early, mid, and late stage, is the workplace doesn't become aware of the presentation of addiction until it's getting late. By the time you see it in the workplace, not only has it been there a long time, it's caused a lot of consequences. This person has already attempted to stop on their own, and a lot of them have. A lot of the early stage people, when their old lady says, "You keep doing this and I'm out of here," a lot of them did stop. And because they had something called recovery capital, they were able to do it on their own. So the ones you're seeing in the workplace weren't able to. By the time you see it, if you say, "Gee, I'll look the other way because it's just starting," and it's probably not early. It's probably much later than you think. And they've probably already paid some consequences. So what is recovery from addiction? It's a process. It's a pursuit. My recovery started, one of the reasons I self-disclose in front of doctors is because what saved my life, it was a fall afternoon in 1983, and I had 10 patients waiting for me in the waiting room of my clinical practice, and I walked out the back door. And as far as I was concerned, I was never going to go back, and I was probably going to suicide. I was so hopeless. But I picked up the telephone, and I called a colleague who had the guts to say in front of a group of doctors, "Hi, my name is Doug, and I'm in recovery from alcoholism." And that gave me hope, and I called him. And my life started to change at that moment, even though my drinking and drug use didn't stop for some time. It was the process, the pursuit of stopping. I had begun the journey, which I'm still on at this point. But the way we can measure recovery and the way we can show it and demonstrate it, and I'm saying in future research on addiction, we should be looking at these things, is people in recovery have demonstratively better mental health and physical health They function better, both at work and at home. They're much better employees, and they're better citizens. They're more likely to contribute and volunteer and pay their taxes and vote. I like to tell people during the federal election, do you know how many people in Canada are in recovery from addiction? There's an estimated, well, it's 9% of the population in the US, they've figured, so it's probably about the same here. So that's like 2 million people. Why don't you know about your neighbor who's in recovery? Why don't you know about it? Still stigma. We don't talk about it, which is one of the things we can change in the workplace. We can talk about it a little bit more. We did a life and recovery survey of Canadians in recovery. We did on behalf of the Canadian Centre on Substance Use and Addiction. I was one of the experts that helped design and administer a questionnaire, a survey of Canadians in recovery. 855 people filled out the survey. It was really amazing what we found out, how happy, healthy, and functional these people were, and what they did to get sober and stay sober, clean sober. So it was, recovery is something that the workplace can have a huge effect on, one way or the other. And when you don't take a stand at all, generally, how do we handle addiction at work or at home when we don't address it? What's the way we handle it? We hide it, we conceal it, we pretend it's not there, and it gets worse. We tend to enable it to get worse. So we can turn that around. Recovery capital is a concept we're not all equally graced in the resources that we bring to addiction. You know, I was born into a middle-class family. We had enough money. I didn't get beat up as a kid. My needs were met. I felt like I was loved. I had a lot going for me. So I had pretty high recovery. And so treatment for me was an awful lot easier than for a person on the downtown east side of Vancouver who was emotionally traumatized, who has mental illness, who has no resources. So the interesting thing about recovery capital is it's like your bank account. Recovery capital is something that goes up and it goes down. At the point that we hit bottom and make a decision to ask for help or not, it's at its lowest ebb usually. It's quite low. But from that point on, it goes up. And so there's lots that we can do to improve and increase recovery capital. Recovery capital is personal, like health and coping skills and values and all of those, whether or not I'm a risk taker. And we decided this morning that I am. I really like being up here. But also there's community recovery capital, there's social recovery capital, there's cultural recovery capital, and there's a lot we can do in the workplace and in the community to improve recovery capital. So that's what I was talking about, the types of recovery capital, mental, family, community, and cultural. And if you look at these, if they address the fact of whether or not I'm going to successfully recover from addiction, and they are a predictor, as you increase recovery capital, you increase the likelihood of a person successfully recovering from addiction. There's a lot of things that we can do in our communities, in our families, in our workplaces to increase the likelihood that people with addictions will get better. Can I get a show of hands? You don't have to, but I'd really like it if you did. How many people in this room think that they have been affected by somebody's substance use or addiction? Yeah, I thought so. And we could probably increase that by 10, 20%. So it's a really common issue that does involve all of us. And once you start looking about safety in the workplace, it involves us tremendously. And it's something that will respond. So stages of recovery from addiction, it's more a rheostat than a flipped switch. So one of the roles of treatment, the best treatment center in the world is just going to initiate recovery. Recovery happens after the treatment center. So initiation Somebody increases my level of motivation, and the early skills I learn is breathe in, breathe out, learn how to say no to the dealer or to the prescriber or to the whatever, my buddies who want me to come back and join them at the bar. Early recovery, which is basically settling my brain down, especially if my drug of choice was something like methamphetamine, which is the new epidemic that's sweeping across Canada. As the opioid epidemic goes down, methamphetamine is coming up. And that takes time for the brain to start working. Hooking up with community of support rather than my community of disease. One of the problems with the current approach in Canada is we're building communities of disease. We're building whole centered cores of community of disorder, of disease, rather than building communities of recovery. And driven by safety, we can change that in the workplace at least. Maintenance it's still not late stage recovery. It's practicing the tools I've learned and just keep working on those skill sets of recovery. How can I feel good if I can't use drugs? Remember, why was I using all those years? I had 19 years of alcohol and then marijuana, and then once I became a doctor, all kinds of other drugs. What would I use them for? You think about it. I was in a little town that didn't have a pharmacy, so I had to stock all the medications for my patients. Think about it. I was very dedicated. I never gave them anything I hadn't tried. But if you take away my medication, because when I was 14 and I started using, that was my main coping skill. If you take away my drugs, what have you done? While you guys were learning how to cope without drugs, I was just using my way through. So I'm really screwed. So I've got a lot of catch up to do during that period of time. And then longer term, I'm at a stage where I can actually give back. I can mentor people, I can volunteer, I can help others. And some people call that the stage of celebration. This graph has 3 curves on it. The black squares look at relapse risk over time. And in general, over time, the risk of relapse goes down. So that's why with airline pilots and with physicians with addiction and with safety-sensitive workers, we monitor them pretty intensely for a period of time. But by the 2-year mark, we can let up because their risk of relapse goes way down. And I've gotten into aircraft where I've recognized the pilot, and when I had my appendix out, I recognized the surgeon because they were people that I treated for addiction. And I felt good going under the knife and getting into that airplane because I knew this person was very safe to be doing their job with me involved. Then if you look at the curve that slowly goes up with the little orange squares, that's the level of recovery capital. And that generally goes up, and there's ways to actually measure that now. It goes up with time. But a curve that I want you to, and I try to impress upon my psychiatric colleagues, are the white squares, and that is my emotional status and quality of life. Initially, we come out of treatment feeling wonderful. We're in a pink cloud, we're evangelical, we're just incredibly happy, but we reach a point in time where the honeymoon ends and we're facing the wreckage of our past, and we're in a family that's still pissed off at us, and we don't have the coping skills, and we start to look really unwell. And we start to look like we got bipolar disorder or post-traumatic stress disorder or all kinds of things because anxiety, depression. But that's a period of time we just need support because we'll grow through it. And then it gets better and better. And it continues to get better. I'm in my 73rd year of life, and it still gets better. So we all have a role to play when it comes to safety with respect to alcohol, drug, or anything that can cause impairment, any substance that we take in. So the person has a responsibility to know and to notify their employer or their manager if they could be impaired and their safety could be impaired. The employer can't allow a person to remain at the workplace in a safety-sensitive position if a substance is affecting their safety and they can't remain there.